Welcome to CardioCast for Friday, October the 25th. I'm Dr. Jim Dwyer. In this week's news, transcatheter valve replacement shows durability out to 5 years in intermediate-risk patients. Patiromer helps chronic kidney disease patients remain on hypertension meds. And a particular heart condition burdens Native Americans more than other ethnicities. But before we start, we'd like to ask for your help in making this podcast better. Please take a moment to complete our short listener survey by following the link in the show notes. And now the news. In the longest follow-up for intermediate-risk patients with severe aortic stenosis, transcatheter and surgical aortic valve replacement had similar rates of death or disabling stroke. That's according to an analysis of outcomes from the PARTNER 2A study, which compared transcatheter aortic valve replacement, or TAVR, using a SAPIEN system to surgical replacement, or SAVR. At 5 years, death or disabling stroke had occurred in 47.9% of the TAVR patients and 43.4% of the surgery group, a non-significant difference. But drilling down, the researchers observed a divergence in that outcome between transfemoral and transthoracic TAVR approaches. In patients whose TAVR procedure was performed transthoracically, a divergence in the primary outcome was noted starting at year 1, such that it was significantly higher at 5 years compared with SAVR. Dr. Vinod Thurani presented the long-term results at the Cardiovascular Therapeutics annual meeting. Another issue he looked at was mean aortic valve gradient and found no difference between TAVR and SAVR. But one difference they found was in rates of paravalvular regurgitation. It was significantly more common in the TAVR than the SAVR patients throughout follow-up, and by year 5, the proportion of patients with moderate to severe PVR was 6.5% in the TAVR group versus 0.4% in the SAVR group. Dr. Roxana Moran commented that the reassurance of the same outcomes at 5 years between the two approaches makes TAVR superior. It's lesser invasive and has a durable result. Among patients with chronic kidney disease with resistant hypertension, adding Patiromer enables more patients to stay on spironolactone. That's the message Dr. Brian Williams of University College London delivered at the scientific meeting of the Heart Failure Society of America. Given the risk of spironolactone-induced hyperkalemia, guidelines typically steer clear of recommending the drug for resistant hypertension in patients with advanced CKD. Dr. Williams explained that having the potassium-binding Patiromer on board allowed for more persistent use of spironolactone. And using Patiromer also helps CKD patients with or without heart failure. Dr. Williams presented findings from the Phase 2 AMBER trial. That trial randomized nearly 300 patients with CKD to spironolactone with either Patiromer or placebo. After 12 weeks, 86% of the Patiromer patients remained on spironolactone, compared with 66% of the placebo patients. And blood pressure lowering was significantly greater in the Patiromer group than in the placebo group. We'll be right back after this message. Over 4 years, atrial fibrillation develops significantly more often in a group of Native American men than it did among other racial and ethnic groups. Researchers at the University of California, San Francisco plumbed California state databases for information on more than 16 million cases of AFib that occurred during 2005 to 2011. Native Americans composed just 0.6% of the cohort. The overall incidence of AFib among Native Americans was 7.5 per 1,000 person years. That's significantly greater than the incidence in a comparator cohort of Black, White, Asian, and Hispanic men. The increased risk appeared to be driven by higher rates of diabetes and chronic kidney disease. The investigators say the heightened risk persisted even after adjustment for known conventional confounders and mediators. That suggests that an unidentified characteristic, including possible genetic or environmental factors, may be responsible. The findings appear in the journal Circulation. The same anti-diabetes medications that improve heart health also appear to blunt the increased risk of dementia associated with type 2 diabetes. It's a benefit that appears to apply to SGLT2 inhibitors and GLP-1 analogs, which have shown clear heart failure and cardiovascular benefits, as well as the DPP-4 inhibitors and good old metformin. In contrast, neither insulin nor the sulfonylureas showed any protective effect against dementia development. In fact, using sulfonylureas was associated with a small but statistically significant 7% increased dementia risk. University of Copenhagen researchers unveiled the findings at the annual Congress of the European College of Neuropsychopharmacology. Dr. Merit Osler is with the University of Copenhagen. Working from a Danish national database, Dr. Osler and her colleagues matched more than 11,000 patients with type 2 diabetes who received a dementia diagnosis with more than 46,000 type 2 diabetes patients without dementia. Patients who had ever used metformin had a significant 6% reduction in the likelihood of dementia compared with metformin non-users. Those on a DPP-4 inhibitor had a 20% reduction in risk, but the SGLT2 inhibitors and GLP-1 analogs showed the greatest risk reduction at 42% for each. And a dose-response relationship was evident. The higher the cumulative exposure to those agents, the lower the odds of dementia. You can find these stories and more by visiting www.mdedge.com/cardiology or by clicking the links in the podcast notes. This week's contributors include Andrew Bowser, Doug Brunk, Bruce Jansen, and Michelle Sullivan. And CardioCast Cardiology News and MDedge Cardiology are edited by Catherine Hackett. Remember, you can find CardioCast via Amazon Alexa, Apple Podcasts, Pandora, or wherever you listen to podcasts. And if you like what you hear, please leave us a rating or review. And be sure to take our short listener survey. For MDedge, I'm Dr. Jim Dwyer.